This eHIV Review Patient Voices program is presented by DKB Med Radio. Adolescents, young adults, and HIV. 13 to 24-year-olds. They're on their way to becoming adults, but are they ready to grow up HIV-free? They comprise 19% of new HIV diagnoses in the U.S. Less than 25% have ever been tested, and only 11% use PrEP. What do they need to know to be able to help themselves? This issue of Patient Voices is a companion piece to our recently published eHIV Review newsletter and video podcast programs on strategies to improve outcomes for young people with exposure to or living with HIV. Our Patient Voices guest today is Andreas Martini. He's 24 years old, a student from Brazil who came to the U.S. to continue his education. 2 years ago, prior to leaving Brazil, he had a full medical workup, including an HIV test. It came back positive. He joins our host, Justin Alves, a nurse and nurse educator at Boston Medical Center and an eHIV Review Program Director, to share the story of his journey. And now, Patient Voices.
Hi, everyone. My name is Justin Alves, and this is Patient Voices, a companion piece to eHIV Review. And I am here today with Andreas Martini to talk about HIV in young people and adolescents. So, Andreas, do you want to say hi and introduce yourself?
Hi, hello. My name is Andreas. I am Brazilian. I have 24 years, and I'm here to talk with Justin. So let's do it.
Fabulous. So one of my first questions for you today really is getting to the heart of what we're talking about, which is young people with HIV. And I'm wondering if you want to tell us a little bit about yourself, when you were first diagnosed with HIV, how old you were, and what that maybe felt like.
Of course. So let's start from the beginning. So I got diagnosed when I was 22, right before I came to America. So it was crazy. Like I was just going for a routine checkup, getting some shots to board the plane. I was graduating, like taking my diploma, fixing my stuff to come to America. And it was just a routine test, So I have been a while since I had tested. So I decided, let me just do it while I'm here. And surprisingly, it came positive. The doctors in Brazil were very supportive of my situation of going to another country. They rushed all the exams, all the procedures to make sure that I could come here with my first medication and a 6-month plan. I have a very good friend that was sending me the medication a month from Brazil to here, ensure I could settle and go after healthcare and providers and stuff here in America. So it was very disturbing, like to just get the news while everything else was going on, But it was not the end of the world because I was lucky enough to get the sexual education in school since an early age. So I know that I slipped up, I got exposed. But even though I knew that I had that, I knew that I had treatment, that my life would not be over, that was not a death sentence anymore. It was just something that I would have to be taken care of closely as I was going to get older.
Yeah. And, I think it's important that even though you said, HIV wasn't a death sentence anymore, like how did you picture HIV fitting into your life at 22, getting told this news about an illness you would have for your whole life? How did that really fit into your plans, even in the immediate, but sort of long term?
Yeah, like it's always a shock when you get the news that you have something that there is no cure per se, So even though it is comforting that you have the treatment and it is not the end of the world, it is a bummer let's say it. You say, oh man, I wish I had wore more condoms, wear PrEP, because it was always there. It was always free. I had the option. I could have been taking better care of myself. Today, I am forced to take care of myself. I have to go take my shots every 2 months. I get tested every 2 months. If I detect something, I go there and take the extra shot. So today, because of my condition, I pay very close care to my health, because I know that I got something extra to take care of. So because of that, I'm forced to take care of. And every time that I talk to my friends, I always say, like, listen, it's better for you to take care before than after, because after you don't have the option anymore. You can go 1 month or two without PrEP when you are not like going out and partying. I cannot go a couple months without my shot, or if you're taking the pill, a couple months without the pill, because then it all goes down, and then you have to do it's you if you stay on track, it's easier, but if you fall off track, you have to get back on track. you know so that's what I tell them. It's easier for you to prevent than you to treat, especially if there is a zombie apocalypse. If there's a zombie apocalypse, I don't get treatment anymore. I don't know how to produce my vaccine out of nothing.
Yeah. And I think, barring a zombie apocalypse, I think what you sort of describe is this: you have to think about your health as a young person now, where maybe you didn't
Yes.
have to think about it before, right? And it's something that's changed about the way you sort of engage in care and live your life.
In a certain way, we treat sexual care as if it is something optional. Let's say, you can get it or you cannot. Like, you need to pay attention or you may not. Like, we treat sexual education and sexual care. Because taking PrEP, doing STD tests, this is sexual care. When everything that involves your sexual life, even if you're too active or not, because you need to be exposed only once. You may be lucky of not getting contaminated, but you might be not. Like, I had a lot of unprotected sex before being infected, and I tested and it was okay. So I was gonna go there and have unprotected sex, and then, I got that. I was tested, I'm okay. It was a relief. But the problem of treating like sexual care as if it was optional, as not giving too much importance, uh, it affects you. So when it makes it easier for you to get contaminated, in a sense, because there is treatment, there is an injection that you can take, so you expose yourself a little more. Like I said, today I don't have the option, but I think that if we pay more serious attention to our sex health, to our sex care, and going to get tested regularly and taking preventive medication like PrEP. And once you have exposure sex, you take the after pill. These are stuff that should be happening on a regular basis for everybody, because, like I said, it's harder to do the aftercare, but it is easier to do the pre-care.
Well, and I think some of the things that you're talking about are things that are barriers both to people trying to get PrEP and people who are trying to get HIV treatment when they're young. And so I'm wondering if you can describe a little bit more about what are the barriers you faced maybe to getting PrEP, or the barriers that you face now getting treatment here in the United States. Did that look like, being new here and trying to figure out a new job and school, and, I have to find someone to treat my HIV?
Yeah, so it was funny coming here because I went to a party. I saw on the door of the party a truck that you guys do the actions. That you go there and you test people and you give information, and that directed me to go to a clinic to get tested, and ultimately led me to you to continue my treatment. So the answer came to me in a certain way, and I think that is the answer to all the questions that you asked me. The thing that prevented me of going after when I was in Brazil, for example, it was that I was lazy. That's the simpler answer. I was lazy to get off my home and go to a doctor and get tested and ask for the prep. It was not much about the shame of it, because it's a medical procedure. You go there, you get tested. I did that once in a while, but you have to stop your routine. You need to go there and you need to get a doctor's note, and but in my case, I think the laziness got the best of me in getting care earlier. Here in America, I see a lot of ads, especially on Instagram, of prep being delivered for free at home. So because I don't need anymore, because I do the treatment, I don't. But if I was here, like seeing that ad, oh no, I'm gonna get it because it's just clicking on a button and it's gonna be on my front door. So I think we're getting in a long way of getting more convenient, and just deliver what people need, because sometimes people don't even know that they need, until they get tested.
Yeah. Well, and I think you kind of described this like the unfamiliar as a young person. I don't think you were lazy. I think it's the unfamiliar of like, how do I do this? How do I take time out of the life I'm trying to live and take care of myself when I feel healthy and I don't feel sick and there's nothing wrong with me? And, a lot of proactive outreach efforts like we have with our van, going out to engage people, right, breaks down some of those barriers about transportation, the healthcare system insecurity, the health insurance stuff, all that kind of stuff. So I think all very good points for folks trying to listen about how do we engage folks in all sorts of places.
Yeah, because not only about sexual education, I think all the world in health related issues in general, we always see as inconvenience. Oh, I need to go to the doctor to get that checked out, especially when insurance is a problem, when healthcare is not free, when you have too much trouble to getting health treatment, health care. So we treat health as a second plan. I don't think we give enough importance to our health as we should. We only pay attention to our health, like you say, when something is not working properly, or something is aching, or something's wrong. But if we start paying attention to when everything is going right, and we detect this kind of stuff early, and I mean in the general sense, like if we give, like it is a cultural thing, it needs a change, and you guys are doing an incredible job at that, knocking at the doors and say, hi, you need help, can I give you some care, and that changes on people's mind, so like, oh no, I need to pay more attention to my health, I need to understand what's going on with myself, I need to go after that. So it's a little cultural too, on the general sense.
And so as we sort of close out our session here, I'm wondering if you can give us like one thing that you wished providers had known, or one thing that you hope providers know after listening to this, who are really taking care of young people with HIV, adolescents who are maybe newly diagnosed, people who are just getting out of college who are newly diagnosed. What do you hope nurses and doctors take away from you talking with me today?
So the main thing that I think that people need to understand when dealing with younger people, like I'm 24, I was just a teenager a couple days ago, so it's still fresh on the memory. Is that we know what sex is. We talked about sex since we are pre-teenagers. Since I'm 12, I am talking about sex with friends at school. We know what it is. The information, it's all there everywhere. So the thing that I think adults have most trouble when talking to young people about sexual education on the health side of the thing is that the sex per se gets too much in the way. So don't know how to talk, don't know how to approach. If you treat something as a delicate matter, it will become a delicate matter. But if you treat just as it is, it's sex. everybody has it. Everybody who is alive was made of it, so everybody knows what it is. If you just treat it like a regular thing, like we go to the bathroom, we have sex, we eat, we leave, it's going to get easier to talk about the health part. If you take the stigma and the walking around eggshells, if you take that part away and you just go to the subject, like show it, to them all. So this is how you're gonna get if you get syphilis. This is how you're gonna get if you get chlamydia. If you get HIV, this is what happens to you. You need to protect yourself. You wanna something that is very good to prevent teenagers to have sex. Birth, deliver videos. That's the best contraception method there are. So just take this shameful part of the way and just talk to them like they understand you, because they do. We are smart. Even though we are kids, we are very smart. So take that part of the way and just go straight forward to the subject, and they will listen more. They will pay more close attention. They will respect you more.
I think that's great advice, to really try and destigmatize the conversation and make it this neutral approach to talking to people about sex and sexual health care. And so I want to thank you for being here with us today and sharing your experiences and thoughts. We always appreciate hearing from patients and getting your insight into these really special topics.
I am the one who's thankful. Thank you very much for having me here, for hearing me. I am the one who actually want to say thank you. You were always giving so much good care. You and your team provide such a good care, coming to us, bringing the information. So in name of your clients and patients, thank you very much.
Thank you for that. And thanks to everyone listening. My name is Justin Alves with Patient Voices at DKB Med's eHIV Review. We were thrilled to have you with us today, and we hope you join us next time.